She was just 46. A young woman full of life, chatting with nurses, smiling after a successful surgery. But within minutes, she began to fade. Her blood pressure plummeted to life-threatening levels. Doctors tried everything. Fluids, vasopressors, dopamine. Nothing worked. She was slipping away. And then, someone suggested a strange, almost forgotten drug. It was blue, normally used for poisonings. But it was their last hope. They gave her methylene blue, and what happened next was nothing short of extraordinary. This story is based on a real case published in a peer-reviewed medical journal. And yes, methylene blue changed everything. The patient. Who was she? Meet Aisha. 46 years old, recently married, planning her first trip abroad. A bright, ambitious woman who had just undergone a minor abdominal surgery. Nothing major, no complications expected. Under general anesthesia, she remained stable throughout the operation. Vitals were perfect. The surgery team closed her up, noted stable condition, and transferred her to recovery. In the PACU, post-anesthesia care unit, she was awake, slightly groggy but in good spirits. She asked for water, smiled at a joke from the nurse. But then, within 15 minutes, it started. She complained of dizziness. Her voice faded. Her hands turned cold. A nurse checked her BP. 74/46. Heart rate, over 91 beats per minute. Saturation, falling. Peripheral pulses, weak. Urine output, negligible. The code team was called. Doctors and nurses swarmed the room. IV fluids were rushed in. First saline, then colloids. Aisha's neck vein was cannulated for central pressure monitoring. Noradrenaline infusion began. No response. Dopamine started. Minimal effect. Dobutamine added. Still no significant rise in BP. The monitor kept flashing danger signs. The ICU team was notified. They ruled out hemorrhage, as there was no internal bleeding. They ruled out cardiac failure, since her echo showed preserved function. They also ruled out sepsis because she had no fever and no signs of infection. Everything pointed to distributive shock, but not the common types. It must be something rare, something elusive. And time was running out. Vasoplegic syndrome. A senior intensivist entered the room. He calmly watched her vitals, touched her hands, and looked at her warm limbs and her flushed skin. Then he said, "This is vasoplegia." Now, vasoplegic syndrome is a kind of distributive shock where the blood vessels completely lose their tone. The heart may pump fine, but the vessels don't constrict. Blood flows freely, but without pressure, like water running through an open pipe. This syndrome is common after cardiac surgery, especially when cardiopulmonary bypass is used. But in non-cardiac surgery, it's extremely rare, yet not impossible. Her signs matched: severely low systemic vascular resistance, SVR, high cardiac output, warm extremities in the middle of shock, and catecholamine resistance. It was a textbook case of vasoplegic syndrome, just outside of the textbook setting. The blue gamble. Introducing methylene blue. But how do you treat vasoplegia? When fluids fail and vasopressors don't work, the culprit is often excess nitric oxide, NO production, which causes extreme vasodilation. That's where methylene blue comes in. Though primarily used to treat methemoglobinemia, methylene blue has another powerful effect. It inhibits nitric oxide synthase and guanylate cyclase, cutting off the pathway that leads to vessel relaxation. In simpler terms, it forces the vessels to tighten back up. But it's not a routine drug. It carries risks: serotonin syndrome, hemolysis in G6PD deficient patients, and paradoxical vasoconstriction if overdosed. Still, in Aisha's case, there was nothing left. The team calculated her dose: 1.5 milligrams per kilogram, slow IV infusion over 20 minutes. The blue dye moved through the line. Her blood turned faintly blue. So did her urine. Everyone watched. Hope returns. 5 minutes passed, then 10. The monitor beeped, this time with hope. Her BP climbed from 74/46 to 94/63, then 98/65. Eventually, 170. Her heart rate dropped to 100. Oxygenation improved. Her mental status cleared. The urine bag started to fill again. It was working. Over the next few hours, all vasopressors were tapered down. Methylene blue had reversed the shock. Aisha was stabilized, then transferred to the ICU for monitoring. Against all odds, over the next 48 hours, Aisha's recovery was steady. No arrhythmias, no organ damage, no neurologic complications. By day 4, she was sitting up in bed, sipping soup, and asking about the blue pea, a known side effect. She had no idea how close she'd come to death. And the medical team? They couldn't stop talking about it. The case was so unique that they published it to remind others to think of Vasoplegia and think Methylene Blue. Lessons from the case. What you should know. This case highlights 3 vital takeaways. 1. Vasoplegic syndrome isn't just for cardiac surgery. It can occur after non-cardiac procedures too, especially under general anesthesia. 2. Standard treatments may fail. When catecholamines don't work, consider nitric oxide overproduction as a cause. 3. Methylene Blue is more than a dye. In critical moments, it can be the drug that turns things around. Have you ever seen a case like this? Would you have thought of Methylene Blue or suspected vasoplegia outside of a cardiac setting? Drop your thoughts in the comments below. Don't forget to like, subscribe, and ring the bell for more true medical stories with life or death twists. Stay curious, stay critical, and sometimes trust the blue.